Hi, I'm Blythe Thomas, Initiative Director at 1000 Days, and I'm here today with Cria Perrine, Commander in the U.S. Public Health Service and lead of CDC's Maternal, Infant, and Toddler Nutrition Team. Hi, Cria, how are you?
Good, thank you.
Good, it's so nice to have you. Well, we're here today to talk about a new report released by the CDC that involves breastfeeding and infant mortality. So let's build some context. What are breastfeeding rates like today? And generally, are we seeing more or fewer people breastfeeding compared to previous years?
So most infants in the US receive breast milk. So about 84% of infants that were born in 2018 were fed some breast milk, but most are not exclusively breastfeeding or continuing to breastfeed as long as recommended. Only about 1/4 of infants are exclusively breastfed for 6 months, which is the recommendation. But rates have been increasing over the years. So there's been a pretty steady increase over the last couple of decades. But disparities do exist. So 76% of Black infants were ever breastfed, compared with 85% of Hispanic infants, 85% of white infants, and 92% of Asian infants.
That's important. Yep, that we really talking about those disparities, thinking through what the public health community can be doing, all of that's critical. At 1000 Days, we're big proponents of breastfeeding. And perhaps for the pregnant people out there watching today who are still learning about their journey ahead, can you talk for a minute about the health benefits of breastfeeding for moms and for babies?
Yeah, there are numerous health benefits. I think some people are familiar with those for infants in particular. So babies who are breastfed have a reduced risk of a number of infections, ear infections, lower respiratory tract infections, and gastrointestinal infections. But the effects of breastfeeding carry on. And so babies later in life have a reduced risk of asthma, type 2 diabetes, and obesity. And then I think less commonly known are the health benefits for moms. So women who breastfeed have a reduced risk of developing breast cancer, ovarian cancer, type 2 diabetes, and hypertension.
You know, I love to hear the benefits. I feel like we talk a lot about the benefits to babies, but as women, I love also that you are sharing examples of how breastfeeding women, breastfeeding people also have benefits for their own health, which is really important. So let's go ahead and dive into the paper. This analysis looked at breastfeeding rates and infant mortality, and that's defined as the death of a child before his or her first birthday. We just recently, last month, recognized Pregnancy and Infant Loss Awareness Day. And the loss of a child is painful beyond words. I know we're both very sensitive to talk about this. Can you share some context about infant mortality in the United States?
Yeah, so obviously the death of a child is devastating, and we want to do everything that we can to prevent them. So infant mortality in the United States is higher than most high-income countries. And again, we do see disparities. So in 2018, Black infants had the highest infant mortality rate, while Asian infants had the lowest infant mortality rate. So in this analysis, where we were looking at the association of breastfeeding with infant deaths, we were just looking at one more potential strategy to help reduce infant deaths across the country.
So in this paper, you looked at data from approximately 3 million births, and you were looking at the connection of breastfeeding and infant mortality. Can you talk a bit about what you found?
Yeah, we linked birth and death certificate data, and we found a 26% reduction in overall infant deaths associated with the initiation of breastfeeding. And we were able to look at it among younger infants and older infants, and the effect was stronger for the very youngest infants. So the reduction in mortality was 40% for infants aged 7 to 27 days versus 19% for infants aged 28 to 364 days. And then we saw this association across most racial ethnic groups, and we were also able to look at causes of death. So breastfeeding was associated with a reduced risk of death from infections, sudden infant death syndrome, and necrotizing enterocolitis, which is a serious intestinal infection that primarily affects preterm infants.
Those are amazing results. I'm really interested to learn about that and hear about that. And we'll put some more information and we'll direct everyone to the paper to learn a little more in the chat during the Facebook Live. Cria, to be clear, there are some people watching who may not be able to breastfeed. We at 1000 Days know there are too many obstacles for pregnant people and new parents to achieve their breastfeeding goals, ranging from lack of paid leave, lack of health care, community support. There's a variety of reasons. What do these findings mean for mothers who cannot meet the recommendation for exclusive breastfeeding for 6 months?
Yeah, this study, we looked only at breastfeeding initiation. So that was just any breastfeeding. And the effect was there, regardless of sort of longer durations and exclusivity. And the effect was also very prominent, like I just noted, for the first 28 days. So among those infants, 7 to 27 days after birth, there was the strongest effect for preventing infant mortality. So even women who aren't able to reach their either their own goals or recommendations, there's still a really important benefit of breastfeeding.
I mean, 27 days, that's incredible. I mean, of course, you know, we want to knock down all the obstacles so that women can achieve those goals. But gosh, I think it's fascinating that, you know, if you can do it for 27 days, you can see these kinds of results. I think it's amazing. So let's come back to the reason behind the study. You at CDC are looking for ways to help people be healthy. Does this prove to you that one strategy to consider when tackling the crisis of infant mortality is an even bigger focus on helping mothers breastfeed?
Yeah, absolutely. I think these findings contribute to showing that breastfeeding is one strategy for helping to prevent infant mortality. You know, we talked about all the other health benefits for both moms and babies, and then this is obviously a critical one. So I think we just, as you've noted, Blythe, we have our work cut out for us. So promoting breastfeeding and supporting mothers in healthcare settings and work in their communities are all critical to make sure that women have this additional benefit and support of breastfeeding.
Was there anything in the study that surprised you? Is it similar to studies that you've seen in the past?
Yeah, we've seen this association in lower middle income countries where having safe water sources and sanitation is potentially a bigger problem. It's not been as well described in high income countries. There have been 2 smaller studies in the US that have shown breastfeeding associated with a reduced risk of infant mortality, but this was really the biggest in linking 3 million births with death certificate data. So I think it's an important contribution.
That's amazing. Thank you. Thank you to you, Cria, to the CDC. This has been so helpful, so enlightening. We're looking forward to sharing this study here with our Facebook colleagues, with our friends and families around the globe, and far and beyond, however we can. So thank you so much. And we look forward to the next opportunity to bring you back on to have another Facebook Live.
Yeah, wonderful. Thank you for having me. And CDC does have resources at www.cdc.gov/breastfeeding if there's interest there.
Perfect. We will definitely include that in the chat as well on our Facebook Live. Thank you, Cria. Take care.
Bye.